Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on WUFO Power 96.5 FM and WUFO AM 1080, we've been in 1080 WUFO for over 50 years. Well, I'm Francesca Messiah, Manager Workforce Development for Kaleida Health, and I'm just so happy that you are listening to our program. And hopefully, there's something in today's program that a takeaway that you can share with your family, your friends, your neighbors, or someone standing in line at the grocery store or church. So I just want to say thank you to our listeners. And if you're new, welcome. Let me tell you a little bit about Kaleida Health. Kaleida Health is Western New York's largest health system. And I normally talk about all the different Kaleida sites. However, today I'm just going to focus on two of our sites, which are Buffalo General Medical Center and Gates Vascular Institute. Just some quick facts. Buffalo General was founded in 1855. We currently have 520 hospital beds. We're 19 stories high when you combine Buffalo General Medical Center and Gates Vascular. It's over 1 million, almost 2 million square feet in square foot. We have 29 operating rooms, 17 interventional labs, 4 MRIS, CAT scanners, and specialized ICUs. And that's surgical, cardiovascular, neuroscience, and medical. In 2024, we had nearly 26,000 inpatient discharges. That means people who were in the hospital and left the hospital. We had nearly 34,000 emergency department visits in 2024. And we had nearly 24,000 outpatient procedures in 2024. So that's just a little quick fact I ran across recently, going through the computer here at Kaleida. And I just wanted to share that with you about Buffalo General Medical Center and Gates Vascular. Our programs today, the first half of our program, we'll be speaking with Sarah Hopkins, talking about the specialty clinics at Kaleida Health. And the second part of the program, we'll be talking about brain health, which specifically talking about Alzheimer's and dementia. Okay, so let's get on with the first part of our program. Good morning, Sarah. How are you?
Good morning, Francesca. I'm wonderful. Thanks so much for having me on today.
Oh, great. And Sarah, you are so hard to catch up with, and I'm so glad we're able to have this conversation. And for our listeners, this is part one, because Sarah is, our topic is specialty clinics at Kaleida Health. We have many specialty clinics, and Sarah is the senior practice manager of the specialty clinics at Buffalo General Medical Center. And today we're going to be talking about two areas within our specialty clinics, which is weight loss and podiatry. So let's jump right into it, Sarah. What is a specialty clinic and where are these specialty clinics located at Kaleida?
A specialty clinic is an office, a doctor's office, where you can come and you can see a doctor or a mid-level provider that has extra training in a specific area of the body. So your primary covers your whole body, covers everything about you from your mental health to your heart to your feet. But sometimes you need to come see a specialist, somebody who has a little extra training in something, like whether it be podiatry, whether it be weight management. You want somebody with a little bit of extra training who can really focus in and really spend time on a specific problem that you're having. So our specialty clinics range all over the hospital. We've got 3 right now in the hospital that all have a variety of specialties in them. And we see so many people today.
And you said at the hospital, I just want to clarify, is that at Buffalo General, at Millard Fillmore Suburban, which hospital?
I'm specifically talking about Buffalo General right now, specialty clinics, but we do have them all over the system.
Oh, okay. That's wonderful. Um, so you already answered my question about the next question, which would have been the difference between the two. And you just said that at specialty clinics, the primary care the physician has extra training. So we've answered that question. And now, what type of services are provided at a podiatry clinic? And I have to tell you, podiatry is a area that our listeners are very interested in learning more about. So, what types of services are provided at the podiatry clinic and where is it located?
Absolutely. So, Buffalo General this year has brought on three brand new podiatrists to the system. We have Dr. Paul Nasca, Dr. Courtney Foote, and Dr. Nick Salerno, all of whom are currently practicing downtown. Some on Buffalo General's campus, some are at our Hurdle Elmwood location as well to offer patients a different access point. But podiatry is mainly from your ankle down. So those doctors have extra training, extra hands-on practice with your foot and your ankle. So they are treating anything from a diabetic foot ulcer, a wound caused by diabetes. They treat bunions, they treat hammer toe, they treat anything really that's going on in your foot that maybe your primary can't figure out and just wants you to get somebody extra to look at. So they do surgery and they see patients in clinic. They do both.
Oh my goodness. Yeah, and I know with foot surgery, I know a lot of times I'm not being sexist, but a lot of times women wear shoes that are ill-fitting. And so they're too high, they're too tight because the shoes are cute. But so if someone's feet are just hurting all the time, can they make an appointment at your clinic or are you taking new patients?
We are absolutely taking new patients, and really any kind of issue patients are having with their feet. We would love to see you, love to take care of you. I myself love a cute shoe, and I get yelled at a lot by my podiatrist now for how that might be causing me some problems later. Um, so I bought a couple of pairs, that are a little bit better for me since they started working with us. But
But maybe
yes, we
not
would
as
love to
cute.
see patients for any problems related to their feet.
Right. Do you do foot surgery? I mean, for somebody, like what is a foot surgery? What's a common foot? Is there such a thing as a common foot surgery that, or a routine foot surgery that you see at your clinic?
Yeah, so there's elective foot surgeries, and then there are surgeries that happen on a patient that might be admitted to the hospital for something a little bit more severe. But if patients have hammer toe and need that corrected, and they want to have surgery, that is an option. Bunions, sometimes patients have very painful bunions that might get in the way of them wearing shoes or, just walking normally. That's a surgery that we would do. And then sometimes patients need a little bit more care to their diabetic ulcers than we could do in the clinic. Sometimes we go to the OR to help debride those wounds, make those wounds a little bit easier to care for. And then on the inpatient side, a patient might come in and they possibly, have had something go a little bit too far with their diabetes. They may need uh, to amputate a toe. They might need something more along those lines. So there are more emergent cases, and then there's cases that we schedule electively.
So you must work along with several departments because because sometimes I think a toe amputation, I think of vascular.
Yes.
Um, okay, so you are in contact with, well, I'm sure with all the services, but I just thought about that one. Okay, so let's talk a little bit about a diabetic foot. Is there such a thing when someone says a diabetic foot? I know one thing, your foot should be like the same color as your skin, correct?
Yes.
Okay. So when would someone with diabetes, when would they need, what's a good time to come in? Should they come in before just for a screening, or should they, when should a diabetic or come and see you at, or your physicians at the specialty clinic?
Absolutely. Great question. So patients who have diabetes should be getting checked at their primary, at their yearly, should be getting their feet checked. And your primary will usually make that referral if they feel like you need to come see someone. But if you are, you're trying to be preventative, um, the thing that happens most commonly with diabetics is they get something called diabetic neuropathy, which means that they lose a little bit of sensation in their limbs, their feet and their fingers. And that sometimes happens when diabetes is a little bit out of control for a long period of time, if it's unmedicated, if it's not treated properly, or sometimes, unfortunately, you do everything right with your diabetes and you still end up with these side effects. But when a patient can't feel what's going on in their feet, we worry that, if they step on something or they, get a tear in the bottom of their foot, they can't see it, they can't feel it, they don't know what's going on. Sometimes those wounds get infected, sometimes they just don't heal. And diabetes sometimes leads to delayed wound healing as well. So there are a number of issues and a number of factors that might go into diabetic foot care, which is why it's so, so important that we see our primary every year, have somebody do diabetic foot checks. Maybe it's once a week, maybe it's once a month. Have somebody looking at the bottom of the feet, and then come to see us if you think you have a problem.
I know you talked about someone looking at the bottom of your feet, and I know we're getting ready to approach some colder weather. Can a family member look at, or a friend look at the bottom of that diabetic's foot and possibly see something? Is there something they should look out for that would make them then have that person call the specialty clinic? Like what would be abnormal on someone's foot?
Sure, absolutely. If a family member's looking at your feet and sees a cut, an ulceration, maybe your skin's just wearing a little bit on the bottom. Sometimes you can tell if it's a little bit pinker than it should be. We definitely want patients to call their primary or call us so we can take a look. Obviously, it's easier to treat before it gets to the point of ulceration or infection. So we want to make sure that that's done preventatively.
Mm-hmm. Oh, yeah. No, thank you so much. And I'm going to ask before we move into our next topic of the specialty clinic, your weight loss bariatric. If someone is listening right now and they are like, I need to call, or a loved one is like, we need to call for mom or dad or grandma, what's the phone number they should call for the podiatry clinic?
Yes, our ortho, spine, and podiatry clinic is all under one umbrella, and patients should call 716-859-1250 and ask for an appointment with one of our podiatrists.
And say that, and could you give the phone number one more time, please?
Of course, it's 716-859-1250.
Thank you. Now moving on, another clinic within the specialty clinics is weight loss. Weight loss, we've talked about this, but not recently. And what services are available? Is it called the weight loss clinic, or is it called bariatric?
So we're calling ourselves the Kaleida Health Weight Management Program now. Because we have all-inclusive services. We now have a medical bariatric doctor. We have a bunch of surgical bariatric doctors for patients who are looking for surgery. We have mid-level nurse practitioners. We have 2 full-time dietitians working with us for nutrition counseling. We have a health coach who's able to talk to patients. She's a personal trainer, and she's trying to help coach patients on, how can they fit a little bit of a workout into their day, or how can they, better their lifestyle through exercise if they're able to, and how they're able to. So we are really proud of the comprehensive clinic that we've built over the last year or so.
Yeah. No, and I can say one thing when it comes to working out. Music is my is if they don't talk about music and exercise, music, and sometimes it's any kind of music. It can be gospel music to exercise to. It can be classical. It can be Tupac. But to me, there's something about exercising and music. So what services are I remember again, I remember being, having interview with you early on when they first started. Do you still offer the same types of procedure for weight loss?
We do, yes. So we have our, like I said, our medical bariatrician, Dr. Bernotis. She focuses on the medical or medication side of weight management. So I'm sure you've heard buzz about GLP-1s,
Mm-mm.
Wegovy,
Wachovia. Yep.
and Zepbound. Yeah, those are very, very popular right now. So she is the provider you would want to see if you wanted to be prescribed a weight loss medication, get some counseling. Maybe you're just not ready for surgery. Maybe that's, or you don't qualify for surgery. So she is a new addition in the last year for us, and she has been just a wonderful addition. And our patients have really been loving seeing her. And then we have our three surgeons. We have Dr. Butch, we have Dr. Posner, and Dr. Yang, who do bariatric surgery, and they're performing the sleeve and the bypass, which we have talked about before it, but not in a couple of years. So
Are there any of them that are still people are still getting? Is the sleeve any more popular than the bypass?
we as a center do more sleeves than bypasses. That's been the national trend for the last probably 10 to 15 years. Is the sleeves are a little bit more popular. Sometimes a patient will have a sleeve and then they end up needing conversion to a bypass. So sometimes patients prefer to start with that. It's a little bit less invasive than a bypass. It's a little bit of an easier recovery. There's a little bit less complication rate with the sleeve. So a lot of patients come in and that's what they have in mind. There's a couple of reasons why you wouldn't be able to have the sleeve, and that would be a discussion that you would need to have with your doctor, and they would determine what the best option was for you.
And I know the different weight loss procedures have been around for a while, which is good because that means there's good data. But can patients gain weight? Do they? Is there a likelihood after you've had either the sleeve or a bypass? Is there, or I should say, what's the likelihood of gaining weight and of regaining? And do patients sometimes if they're not careful, can they regain some of that weight?
Absolutely. We want to see our patients for life. When you have surgery with us at Buffalo General, we would like to see you for life because some patients do absolutely struggle after that initial weight loss. Body's changing really rapidly in that first year and a half after bariatric surgery, and then it kind of stabilizes a little bit. Maybe your stomach stretches back out a little bit. Maybe some of your hunger hormones return and you're feeling hungry again. It's a little bit more difficult for patients to control their portion sizes. So there is a possibility of weight gain. Usually patients lose weight for the first year and a half, and then they come up, they get to their lowest weight and they come up a little bit, and then that's where they stabilize is the general trend. But we're here for you if you struggle after surgery. That's why we want to see our patients on a regular cadence and see them, every 6 months to a year after surgery, so we can catch you if you're struggling. And maybe it's diet related. Maybe you're really maybe you got way busier in the last year and you have to eat fast food or takeout more often, and you're really struggling with choosing healthy options. We've got two dietitians that would love to see you, sit down with you, and come up with a plan that's really right for you, because it's not a one size fits all.
No, no, definitely not. And I know we've had almost about 3 times a year or so. I bring a dietitian on Kelly to talk about different uh, prevention, prevention slash eating healthy. So we're always talking, often we're talking about that. Um, so what is the process then? I know that internally on what's called Kaleidoscope, for those of you who don't work at Kaleida, I always see where you're having I'm looking right now. Weight loss. Oh no, I don't see. I see diabetes, but a lot of times you have weight loss. What is it? Sessions? What is that called? Where people can come and see if this is what they want. What are those programs called that you have?
Sure, yeah, we call them seminars. Um,
Seminars.
we are Yes, so we've actually transitioned in the last year or so to an online only platform for seminars because we recognize that it's very difficult for patients to come downtown, middle of the day or even right after work. They're tired, they've got kids, they've got stuff going on. So we have transitioned to 100% online seminars that patients can just learn a little bit more about the surgery process at their own pace. They can do it at 3 o'clock in the morning. They can do it at 7 p.m. whenever they have time. They just click on the link and they're able to log in and view that.
Hmm. Yeah, and I guess that I'm thinking if some of the evening sessions, if somebody were to go to an evening session, they might be so hungry that they may eat more than they would normally eat following that session, which is what you don't want.
Yeah, yeah, absolutely. We have so much going on. Everybody is so busy nowadays. To ask patients to come in for an in-person seminar before they've even decided if it's what's right for them, if it's something that they want to do. We find that patients like the online option a little bit better.
And you don't have to worry about parking or anything. Not not online. Um, what is something? Okay, so we've talked about the supports that are in place, the dietitian. Are there social workers who are involved in at all in as supports?
We have a network of social workers and psychologists in the community that we work with and refer to. We have people that we have looked to for over 20 years now to help our bariatric patients. We have providers that specialize in eating disorders or behavioral modification, and we refer our patients to those providers in the community right now. We would love to have behavioral health sometime in the future, but it's not in the cards right now.
And psychologists, I would say the reason behind that, because sometimes if you are used to eating a lot and you're with your friends who, you go out, some places I can't name any names, but they have some really good unhealthy food. And now you want to continue hanging out with your friends, but it's like, how do you tell them, I just can't eat like that anymore? So sometimes that psychologist is able to help you think through how to answer the questions. No one can answer a question for you. However, sometimes you just have to share with your friends, I don't eat like that anymore, and be able to feel comfortable just saying that. Anything else we haven't discussed? We have 3 minutes left. Anything else we haven't discussed that you would like to add? And number one, can you include the phone number for the weight loss specialty clinic?
Of course. Of course, yes. The number for our weight management program is 716-859-1168. 716-859-1168.
Thank you. And anything else that you would like to share with us that we haven't covered today?
No, I think that patients, if they're interested in weight management, should absolutely visit our website. The Kaleida Health website has some great information. You can meet our team. We've got some pictures of our team on there, and you can see what's involved in joining the program. There's a couple extra resources And there's actually even like a contact us form right on the website you can fill out and we'll reach out to you.
How about family members? Can family members come along?
Of course, we encourage it.
Hmm. Oh, good. Yeah, because again, it's a family, again, it's a change. If someone, is going to weight management, has been used to preparing preparing food in one style, what weight management will teach you is how to prepare it in another style. So it still could be chicken and fries, but it could be baked chicken with just salt and pepper, a little seasoning, and air frying. I'm just saying that, or put your French fries in the oven and just not to have as many. But that frying, just how, so still eating the same food, but maybe not fried.
Yeah, and just having a support system is so, so important in any weight loss journey. Need people to lean on. It's not easy, and you want to have your family and friends on board.
And as Sarah said, there is a support system. You have a team, you have a network around you. So you are not out there alone with weight management, and bring that supportive person with you. Sometimes it's family, sometimes it may not be family, but you want to have that. You want to bring your cheerleader.
Absolutely.
Yeah. So So, Sarah, I know we're going to pick up with some of the other specialty clinics. This is part one of our conversation about specialty clinics at Kaleida Health with Sarah Hopkins, who is the senior practice manager of the specialty clinics at Buffalo General Medical Center. And listeners, stay tuned because in about 30 seconds, the second part of our program will begin talking about brain health, Alzheimer's, and dementia. Catch you on the flip side. Thank you, Sarah.
Thank you, Francesca.
And now on to part two. And welcome to the second part of the Great Lakes Health Radio program here on WUFO 96.5 FM and WUFO AM. Or you might be listening to us through one of the streaming services. I'm just want to welcome you, and I want to thank you for listening and staying with us through the second part to this part of our program. As I said earlier today, that our this part of our program is talking about something that sometimes we joke about, sometimes we don't joke about, because it's a very serious topic. And that topic is it's not even your brain health, it is brain health, but it's your brain health, Alzheimer's, and dementia. So we're going to be talking about that this morning. And you know what I didn't do? If you're just now listening, I didn't introduce myself. I'm Francesca Messiah, Kaleida Health Manager, Workforce Development. And now I want to introduce our two guests for today, Ian Barrett, uh, Ian from not only is Ian with Kaleida Health, Ian is also part of the um, uh, Health Fellows Leadership Program. Good morning, Ian. How are you?
Good morning, Francesca. I am well. Thank you for
Oh,
having me.
oh, yes. And we also have Amanda Nobrega. Good morning, Amanda. How are you?
I'm wonderful. Thank you, Francesca, for having me.
Oh, absolutely. And Amanda is the as a licensed master social worker, and she's also vice president of programs at the Alzheimer's Association. And also, I didn't mention that Ian Barrett is also the executive vice president and chief human resource officer at Kaleida Health and part of the Fellowship Leaders Program. So we have such a important topic, and I know we could talk for hours about it. So, Ian, if you could just talk briefly about, for listeners who may not be aware of the Health Leadership Fellows Program, if you could just briefly provide an overview of the Health Leadership Fellows Program.
Yes, of course. So, the Health Foundation for Western and Central New York They run the Health Leadership Fellows Program. I'm in the 11th cohort, and actually, the 12th cohort is now being assembled. So the cohort is focused on community health capacity and capacity building. And so the people in the program are broadly related to health. So people who work in community-based organizations and health systems, and the opportunities for us to build our leadership skills and to work together. Generally speaking, about 40 people are selected into this 18-month cohort program. The program includes 4 2 to 3 day residential sessions. It also includes coaching. And then another part of the program is a project. And so my Team Keeley, is working on this project that we title 10-10-3 Brain Health Challenge. So that's the program in a nutshell. A project is a part of the program, and I'm working on this project with colleagues.
Wonderful. Thank you so much. And it's also Western and Central New York. So there's also, are people from Rochester and like Syracuse also part of the Fellows Leadership Program?
Yes, of course. So we have people from both of those cities and as a part of the program. And then we have people from the Southern Tier. So
Oh,
it's
from the Southern,
a
yes.
regional program. And so the 40 people come from those 4 communities.
Mm-hmm. Well, and now on with our topic for today. We're talking about 10-10-3, 10-10-3. And so Brain Health Challenge. So what is 10-10-3 Brain Health Challenge?
Sure. So I'll start and then I'll invite Amanda to jump in. So we landed on this project, which I think is going to be your next topic, your next question. So I'll just answer it now. I don't remember how we landed here. We actually started off with workforce, which Fran, you and I work on every day, right? The health
Yes.
workforce. And then we segued to brain health and specifically to, Alzheimer's and dementia. And so we've worked with the Alzheimer's Association of Western New York and also to the Erie County Office of Health Equity in order to launch this program. So the 10-10-3 Brain Health Challenge, it's the 10 early signs and symptoms of dementia, the 10 healthy habits for your brain. And then we're asking people to commit to 3 healthy habits. So that's how we came up with the 10-10-3. And so it's our project. We are implementing this across Western New York. It's really a pilot project that we're trying on the radio station, in person. We're doing health fairs. And we are going to see how this works. And then our ultimate goal, we've already talked to the Alzheimer's Association about possibly partnering on this and moving this forward, even after our project is over. We've gotten great response. People are really interested in talking about brain health, Alzheimer's, and other dementias. And so I think we've hit a sweet spot around a need in our community.
Yeah. And Ian, one of the things you just mentioned that you are currently in several venues doing this and talking about this. But if someone wants to come to their church or come to their, I think it's still PTA meeting, or come to their school, how can they reach? Who should they contact? Who should they call if they want you to come in within the next few weeks and do this?
Sure. They can call me or they can text me, or they can email me. So I'm happy. The easiest way to reach me is iancbarrett@gmail.com. So that's an easy way for people to reach me if they're interested in us coming out to do this at their church or their community center or health fair. That's a great way to reach out to us.
And if you could say that one more time, the email
Sure.
address.
iancbarrett@gmail.com.
Thank you. Amanda, how has the Alzheimer's Association assisted with the 10-10-3 Brain Health Challenge?
Yeah, so I was just so incredibly delighted to learn that Team Keeley of the Health Foundation's fellow program was really interested in moving this work forward. It's so important. Brain health touches every family. And, the fellows really recognized the growing prevalence of dementia, and the opportunity to reduce risk and to get that messaging out there. We know that communities of color and underserved populations are at higher risk, and yet awareness and resources are not always accessible. And so we're so grateful to be able to work with the Health Fellows cohort and Erie County Department of Health Office for Health Equity, among other partners, to really get this work moving and mobilized in community. So from the beginning, we were reached out to and so excited to hear about this, and have really been a resource in helping to provide accurate content, and really supporting distribution. And as Ian mentioned, because one of the health fellows who is part of Team Keeley is from the Erie County Department of Health's Office for Health Equity, we were able to integrate the 10-10-3 challenge into some work we were already doing with the county health department.
Okay, yeah, that's great. And we have to give a shout out to Kelly Wolford.
Yes.
Yes, we have to
With
give
the
a
Erie
shout out.
County. That's right. We're friends of Kelly. We are all friends. The community is a friend of Kelly. Ian, I just want to go back for a second. You talked about the 10 early signs and symptoms and the 10 healthy habits for your brain. I don't know, feel free to start with one. I don't know if you take one, Amanda takes the other, but Ian, let me start with you. What are the 10 early signs and symptoms of dementia? And I just want our listeners to know, if you're gonna contact Ian, which I hope you do, these are the questions that he'll be speaking with your audience about.
So sure, I'll start with the signs and symptoms. So signs are normally visible or can be measured. And then symptoms are conditions you may feel or notice, but others might not see. Everyone is unique. And so we encourage people to talk to their provider to learn more about your unique signs and symptoms. So the 10 early signs and symptoms of dementia are memory loss that disrupts daily life. So it's not like me forgetting where I put my keys or my cell phone, because I do that sort of like every day, but and that's not as disruptive as something else, right? Something that disrupts your life. So memory loss is the first one. The second one is challenges in planning or solving problems. The third one is difficulty completing familiar tasks. The fourth is confusion with time or space. The fifth one is trouble understanding visual images and spatial relationships. The sixth one is new problems with words in speaking or writing. The seventh is misplacing things and losing the ability to retrace steps. The eighth is decreased or poor judgment. The ninth is withdrawal from work or social activities. And then the 10th one is changes in mood and personality. And so those are the 10 early signs and symptoms of dementia.
And how about then let's move on to the second 10, because it's 10-10-3. So the second 10 are the healthy habits for your brain.
Yes. So here are the healthy habits for your brain. And one of the things we say about these healthy habits is not only are they good for your brain, but they're good for your overall health as well. And people may already be doing some of these 10 things. And what we'd encourage people to do is to continue to do what they're doing, and then to add on one or two to the things that they're already doing. So the 10 healthy habits for your brain are to challenge your mind and keep learning. So oftentimes we're talking about, those puzzles are great, or maybe even games that you play on your phone, but something that keeps your mind active, where you are actually using your mind and your brain. The second one is to stay connected. That's so important. We learned during COVID that isolation isn't good for any of us. And so stay connected is important. The third one is to get moving. And so my doctor always talks about this one when I go to see him. And so get moving, doing some kind of exercise is important. The fourth one is one that I don't want to talk about specifically, but it's maintaining a healthy weight, because my doctor always gets on me about that as well. The fifth one is to protect your head. So whether that is, riding a bicycle or riding a motorcycle or any other kind of activity where a helmet you generally wear, we encourage people to protect their head. The sixth one is to be smoke free. The seventh one is to control your blood pressure. The eighth one is to manage your diabetes. The ninth one is to eat your fruits and vegetables. And then the 10th one is to sleep well. So you can see that many of these things are things that we're already doing, we should be doing. They improve our overall health, but they also improve our brain health as well. Amanda, do you want to add anything to what I've said about the 10-10, the 10 and the 10?
I think you did a wonderful job recapping, Ian. And, the 10-10-3 challenge is really a great way to start taking charge of your brain health. I also want folks to know that the Alzheimer's Association is here for you 24/7. So if you have questions about brain health, memory concerns, caregiving, maybe you were recently diagnosed yourself with Alzheimer's or another form of dementia, you can call us anytime around the clock. It could be on the weekend, during a holiday, during a snowstorm. We're going to be available at 1-800-272-3900, or you can visit alz.org. That's alz.org. So, if there's any more information that you're curious about, definitely tap Ian and Team Keeley for the 10-10-3 challenge, and also know that the Alzheimer's Association is here for you as well.
Thank you. And the 3. So we've talked about 10, we've talked about healthy brain, we've talked about 10 early signs and symptoms of dementia. And what is the 3 when we talk about 10-10-3?
So we're asking people to commit to 3 of the healthy habits for your brain. And so as we talk to people like we are now via this radio program, when we're at health fairs, when we are in front of groups, we're asking people to, and in person we have a card so people can actually check off the 3 things. Mine, I've already talked about my healthy weight. Hopefully my doctor is out there listening to me. But that's one. Get moving is another. And then sleeping well. It's just so easy for me to try to think I'm going to get by on 6 hours of sleep where I really need 7 or 8. So those are my 3.
Yeah, I'm guilty of the sleep one myself. Amanda, Alzheimer's Association. I know that in the past they've been members of the Near East and West Side Task Force. They've done outreach in the community, but how does the Alzheimer's Association reach out to communities of color? Because one of the things Ian mentioned earlier in the interview was that how communities of color have a greater impact, or how they're impacted more by Alzheimer's and dementia. So how does the Alzheimer's Association reach out to communities of color?
Yeah, that's a great question, Fran, and something that is really the cornerstone of our mission and our work. We truly believe that elevating the voices of people within the community is incredibly important. And so we have a team of wonderful staff, volunteer board members, community partners who we work hand in hand with to really empower people from the communities that we're talking about, to learn more about the resources that are available and to perhaps get trained to deliver some of the education or facilitate a support group to their friends and neighbors. So really just leaning into partnership, showing up, being consistent and elevating voices of people who are trusted within the community, who see that this is important and who want to be there for their community members.
Thank you. And then Ian or Amanda, if you were doing this presentation in front of an audience, what are the questions you would ask?
So we're doing this as a pilot. We're collecting data for research purposes, and also we're going to summarize that data. We are also going to make recommendations for future work. So the questions that we ask when we're doing this in person, but there's a presentation, and before we present the 10-10-3, we ask people to raise their hands if they know any of the 10 early signs and symptoms. We also ask them to raise their hands if they know any of the 10 healthy habits. After we present the information, we ask them, do they know any of the 10 early signs and symptoms? And we expect 100% of the hands to go up. And then we also ask them if they know any of the 10 healthy habits, and we expect 100% of the people will say that they do. The fifth question we ask is how many people are willing to commit to 3 healthy habits? And for the most part, when we're doing this in person, most people commit to at least 3, because again, most people are doing some of these already. And then the last question that we ask people is how many people found our presentation helpful? And I'd say a majority of the people find our presentation helpful. I will also say that the questions and the presentation helps to generate additional discussions with people. People have questions. People want to share their own personal stories. And generally, we're doing this as a sort of a public health project. For more detailed and specific questions, we would refer people to their providers. And then we would also to refer people to Amanda and her team at the Alzheimer's Association. And then some of the questions we refer to Kelly at the Office of Health Equity with Erie County. And that's how the sessions in person generally run.
Mm-hmm. Yeah, and how much time if because I know there are listeners, I know there are people listening right now who would welcome you to come and give the presentation. How much time should they allot on their sketch on their agenda for you for the presentation?
Sure, depending on the size of the group and discussion, anywhere from 15 to 30 minutes. We can get this done in 30 minutes easy, but it can also be shorter depending on how much time we have on the agenda.
Mm-hmm. And I'm sure it also depends on how many people are asking questions.
Sure. I think I mentioned this earlier, people want to share their stories. I think, many people, I think almost everyone is touched by brain health, as Amanda said earlier, but by Alzheimer's or some other form of dementia. So, I know it sort of runs on both sides of my family. And so in person, I generally tell a story about how it's impacted me, and people want to tell their stories as well. So that's a part of the sharing, which I think helps all of us as we deal with improving brain health and also to supporting our family members who may have Alzheimer's or another dementia.
Mm-hmm. And can you because I know there are listeners who probably they probably maybe they got kind of stuck in that, am I losing my keys, am I okay, or I can't find my car in the parking lot. Could you just repeat the healthy habits along with the early warning signs and symptoms of dementia?
Sure, I'm happy to do those. So the 10 early signs and symptoms of dementia are memory loss that disrupts daily life, challenges in planning or solving problems, difficulty in completing familiar tasks, confusion with time or space, trouble understanding visual images and spatial relationships, new problems with words in speaking or writing, misplacing things and losing the ability to retrace steps, decreased or poor judgment, withdrawal from work or social activities, and last but not least, changes in mood and personality. Mm. And so then the 10 healthy habits for your brain are challenge your mind and keep learning, stay connected with others, get moving, maintain healthy weight, protect your head, be smoke-free, control your blood pressure, manage your diabetes, eat more fruits and vegetables, and sleep well.
Thank you. Now, Amanda, when you're in the community or when you're working on projects with your colleagues, are these the areas that have been identified by Team Keeley? for a 10-10 Brain Health Challenge with the Health Leadership Fellows Program. Are these the same thing concerns that you're hearing in your meetings at the Alzheimer's Association?
Yes, absolutely. And we're very grateful that Team Keeley is elevating these messages. The 10 healthy habits for your brain are extremely important, as well as knowing what the warning signs of dementia are. There are things that are typical as we age that, are normal age-related changes, but then other things that really are more of a red flag. And we're really at an exciting time now because for the first time ever, we have treatments that can modify the course of the disease. So that means giving people more time in the earlier stages of the disease, where they can spend time with their family members, their friends, they can put their affairs in order, they can, enjoy a day outside feeling the sun on their face or whatever it is. We know that it's so important to get people aware of what those warning signs are and to get them to take action in terms of connecting with their provider to explain what they're noticing. And there's also new evidence that was actually just released. I want to say it was in July. The Alzheimer's Association actually funded a randomized controlled trial to take a look at lifestyle interventions and the impact that they have on brain health and potentially staving away cognitive impairment. That study was called the U.S. Pointer Study, and the results were just released, and we know that there is a way that we can take action in terms of combination of diet, exercise, social activity, managing heart health and risk that did in fact show to slow cognitive decline. So the 10-10-3 challenge is important. The Alzheimer's Association also has those 10 warning signs on our website, the 10 healthy habits on our website, as well as guidance documents to help folks have those conversations with loved ones and with their physicians.
Yeah, and I have to add, I get emotional on my shows sometimes. For the listener who is experiencing this, because I know some of you are experiencing this right now with a loved one, what you can do, number one, is be patient. You're patient with a baby, if a baby can't do things, right? An infant, a child, a toddler, and you have to be patient if that loved one in your house is experiencing some of these same things. You can't yell. I can't believe you did this again. You can't. I mean, there are things that we can also do if we do see this, because it can be very what's the word I'm trying to look for? What's the word I'm looking for, Ian? To go with patience. You have to be patient. You have to be understanding. What's another word you would say?
I think you have to be supportive, right?
Supportive.
I think
Supportive.
it's so important.
Yeah. You have to be supportive, because nobody wants to be in this stage. So you just have to be supportive, patient, loving. It's okay, because this could happen to any of us. There are people who do have early signs of Alzheimer's and dementia. So it's not necessarily when you get older. It can happen at an earlier age. We have about 3 minutes left in the program. Something else you would like to add, Amanda or Ian, that we haven't mentioned?
So I'd like to give credit to the Alzheimer's Association for the 10 early signs and symptoms and the 10 healthy habits. So we're actually referencing and using their work. So the Alzheimer's Association does a lot to support people and families with Alzheimer's and other dementia. And so our project would not be possible without the Alzheimer's Association and Amanda and her team. So thank you, Amanda, for your support.
Thank you. And
you.
Amanda, closing comments.
Start today. Reach out.
I love it.
Yeah, reach out to Ian, reach out to the Alzheimer's Association. Think about taking that one small step. Do it with a friend to hold yourself accountable. There are steps that we can take. So let's start today.
And I'm going to call on the health ministries of all of our churches, our faith base, our temples, our mosques. I feel this is a great presentation. It doesn't take a lot of time, but I feel it would be very beneficial when it comes to also educating your congregation, your mosque, your members. I just think this is great. Or education, health class. This is great for high school. This is great for any age. This 1010 health survey. And just one quick question. I have 30 seconds left. When would you ideally like for people to reach you? Because I know you have to compile data.
We'd love to we'd like to do all of our sessions in September, based on our schedule. If it runs into early October, that works. But I'd say over the next 4 weeks, we'd love to be able to host a session or do a health fair, in order to share this information with people who are interested in brain health.
Thank you. Thank you so much. I want to thank Ian Barrett. I want to thank Amanda Nobrega for being our guest this morning on the Great Lakes Health Radio program. I'm Francesca Messiah, Manager, Workforce Development, the host. But next week you'll hear my colleague from ECMC, and that is Cindy Bass. She will have another exciting show, and then I'll be back the fourth Saturday. And until then, stay healthy, be well, be safe. Bye-bye. Thank you for listening.